Hi girls, I wanted to introduce you today to Dr. Cunningham. He is with Vein and Laser Clinic, is that correct?
That's right.
Alright, and I am 40 plus 1, and we start to notice those things that we don't really much care for about ourselves, and one of the things that I have not enjoyed is the fact that I quit wearing shorts and short skirts. Even though I don't mind the shape of my legs, I just don't like the veins. So I sought out Dr. Cunningham, and I have learned a lot about veins since coming to him, and I wanted to introduce Cindy to him today and tell you...
Hi, Dr. Cunningham.
Hello, nice to meet you.
And just tell you a little bit about some of the things that I have learned, because I'm telling you, it's pretty significant in what your quality of life will be if you find these issues, and I know he can help clear those up. So we are excited to hear about some treatments that are most likely the common reasons why women come to see you.
And I know, like, well, I shouldn't say, an older woman who I happen to sort of be related to. If I say her name, she'll kill me. But she's had some treatment for veins in the past that didn't work, and now it looks like, you know, it's come so far since she had that done. What's changed over the years?
Well, the treatments that we do now are really not that different than the treatments that we've always done.
Mm-hmm.
But they've just been refined over time.
Gotcha.
So we're still doing the same basic process. The majority of patients we do sclerotherapy for, which is inject them with medications that cause the vessels to shrink and get smaller. And it works very well. It's just that, and we even use the same medicines now that we used to use. But again, we just refined how much we use the concentrations and just some of the techniques and how we approach using those old solutions.
And are we going to use your legs as an example?
Yes.
That's what I've heard. That's what I told
One of us volunteered and one of us didn't.
Who was it?
We actually are going to show his photo album, which we're going to pick the tame one so you won't gross out too much, but we wanted to show some examples of things that you work on quite frequently, and give you an idea of some things that you can do for your veins no matter where they are on your body. I've learned that it's just not the legs. So,
what do we have here?
Well, these are classic spider veins, and spider veins come in all colors and shapes and sizes, and some people come in, they have a vein that they're not sure what it is, but they can look like so many different things. Sometimes you just have to see them to know. But in any case, these are spider veins, and this is a typical area. We see this all the time. And this is before, and this is afterwards. So
that's amazing.
it cleared up very nicely. This patient got very, very good results. Some people will get results that are better. Some people will get results that aren't quite as good, but still almost everybody will see significant improvements.
All right.
And again, more spider veins, and you can see that they look a little different. Some are similar, some are a little different. Here's a little bit bulgier vessel there. Again, this is done with sclerotherapy. We just inject this with medications, and over a series of sessions they'll get less and less and less until they finally are significantly improved. And the same thing, a little bit more of a mix, more of the typical spider veins, and then some veins that are just a little bit bigger, a little bulgier. A lot of patients will call this a varicose vein, although we would not typically classify that quite as a varicose vein because it's not big enough. But these veins, all these veins, the larger ones and the smaller ones, again, just do this with sclerotherapy.
These are more spider veins.
These are spider veins. These are actually called reticular veins, so they're sort of in between a varicose and a spider vein. But all this can be done with injection.
Okay.
And again, more spider veins, fairly typical looking. Again, see those in the same areas. People can have these anywhere, it's true, but there are certain areas of the leg that they tend to occur very commonly, and this is one of them. And again, that's before, and this is after sclerotherapy, again done with injection treatments.
And we should give a little warning before we show you this next picture. Wow.
Alright, so some varicose veins, and again, it's a dimension, it's a size. So as these vessels become larger, and what's important about these vessels is the fact that they are so large, they have significant effects on circulation. Whereas the spider veins, they can cause some symptoms, but their effects on circulation are relatively small. So the risk of clots or ulcers, that kind of thing, is very small. Whereas with this, you start to run into those risks. So these sorts of vessels are where insurance companies will sometimes say, well, okay, that's medically necessary. But in any case, as far as treating these veins you have to treat surgically. What's changed is the surgery. So the older surgeries, and I don't know, are we going to show that picture? Maybe we'll show a picture of what a leg looks like from an older surgery. But with the modern procedures, they're done in the office. We just use a local anesthesia like the dentist, maybe give you some happy pills so you're more comfortable, and then these are actually removed. But the incisions that we make are so tiny that there are no visible scars. It doesn't require any stitches, and patients are active from the first day. They're back at work usually the very next day.
And cost on something like this, what does it generally run?
For the spider veins, it's by the session. So for our clinic, a treatment of spider veins is $275, and the total cost will just depend on how many treatments you need. So someone with a lot of spider veins can be quite a few treatment sessions to get that done. So
I think my legs may be thousands of dollars.
it can get there sometimes. But since it's by the treatment, it's automatically something that you don't have to encounter that expense up front. Because I don't even know how many treatments you're going to need. I can give you some reasonable estimate of what I think it's going to be, but still, until we actually do it, you don't know. So if somebody needs two treatments, somebody else might need 5 or 6 treatments. I've had patients need as many as 10 treatments, and of course that can get rather expensive. But again, it's over time. It's not all up front. It's not all at once. You just do them as you go. You pay as you go until you either get it as good as we can get it, or until you're happy.
Awesome. And Jill?
Mine, we decided that my treatments would probably be 3 to 6 times, and I've already gone through my first 2 treatments, and so far so good. But we are doing the injections for my legs, so you know, the first treatment's a little shaky, but then you get to where you really.
Patients are very different. Patients are very different. Some patients, it just doesn't bother them at all. They could just about take a nap. It just doesn't bother them.
That would be Jill. And the other patients?
Other patients, it certainly is. They're more anxious about it. It's a little more uncomfortable for them. We do hundreds and hundreds and hundreds and hundreds of these spider vein treatments every year. And if we need to, if somebody's really nervous, we can always give them medicine to help them relax, and we do that a couple of times.
I didn't know that was an option. Excuse me.
But you do lose a day. So,
We do, that's true.
It's not,
That's true.
You need a driver, and it does make it a little more involved. But and it's just very rare. Most people find it uncomfortable but tolerable, and they do fine with it.
Yeah, usually I'm texting while he is shooting me with the little. What are they? Syringes.
Syringes.
Little needles.
The needles are really tiny, but they're still needles, so they're not like they're big, huge.
Sort of feels like a little sting, like a little bee sting. Most of the time. Sometimes you'll hit a nerve, and those out.
We don't want to talk about those times.
Okay, but then
some spots.
it does happen.
Yeah, some spots don't hurt at all. You can't. People won't even feel it, and then another spot it will be very sensitive. So it's a hit and miss thing as you go along doing the treatment.
Well, I think when we come back, we're going to finish up Jill and see how all this works.
How it works.